We begin this series with choosing the right physician who will ensure the best results when undergoing any kind of cosmetic surgery. We spoke with Linda Morrow, Executive Director of the Morrow Institute, who has significant guidelines for making that important choice.
There's a lot of confusion about who's qualified to perform cosmetic surgery these days. As cosmetic surgery is becoming more popular and more physicians enter the field of cosmetic surgery, there is competition within the field. One type of surgeon says that he's more qualified, another type of surgeon says that she's more qualified, and this results in a lot of confusion as to who actually is qualified to perform cosmetic surgery. We can eliminate some of this confusion by outlining some objective criteria in which you can evaluate the credentials, the experience, and the skill of your cosmetic surgeon. The first criteria that anyone should check is the board certification of your physician. Board certification means that your doctor, in addition to attending medical school, has attended at least 4 to 5 years of additional residency training in a particular specialty. The American Board of Medical Specialties was established almost 100 years ago to set up a standard for board certification in all specialties. It's important to actually know the surgical experience of your surgeon. One of the questions to ask is, how many years has he or she been in practice? Another very important question is, what procedures does that surgeon specialize in? Of course, as a layperson, it's hard to evaluate the skill of a surgeon, but even a layperson can look at before and after pictures and ask to meet actual patients of that surgeon. Does the surgery look natural? Is the person happy? Those are some of the things that anybody can actually see for themselves. Once you've evaluated the surgeon's credentials, their surgical experience, and their skill, the next question to ask is, what is the quality of the surgical environment? Is that cosmetic surgery procedure going to be performed in a hospital or in an outpatient surgery center that is fully accredited? In addition to looking at the surgical setting, you also want to determine if an anesthesia specialist, that means either a board-certified anesthesiologist or a nurse anesthetist, will be present at all times during the surgery. Another objective criteria to consider is the professional reputation of that surgeon. Does the surgeon have a university faculty appointment, which shows that he's respected by his peers? Has he or she been published in peer-reviewed journals? What kind of research or innovations has that surgeon contributed to the field of cosmetic surgery? And finally, is that surgeon a member of a reputable hospital staff in the area in which you are going to have your surgery? Once you have satisfied yourself that the objective criteria of board certification, professional affiliation, skill, expertise, and surgical environment is correct, the final criteria is really very subjective. Do you like the surgeon? Do you get along with him? Do you feel that you can communicate your ideas and your desires to that person? This is somebody that you're going to be working with to achieve a goal for yourself that is hopefully natural looking and long lasting.